Good evening. My name is Cameron Lewis, and this is the media presentation for English 112. I have actually done this on, sorry, I'm trying to get the thing to square over. Benefits of exercise for the elderly. For the elderly, for people in general, there are a lot of benefits of exercise. To stay safe, to lose or maintain a healthy weight, to increase metabolism, increase overall health. So we're going to expand into this a little bit more. There are many important benefits of exercise, and they do carry over to the older age. In general, activity in general is very good. There are 3.2 million deaths per year caused by inactivity. That also leads to chronic illnesses, diabetes, cardiac disease. And for those reasons, starting young and staying active into the older years helps prevent those ailments from starting and becoming really prevalent there. It's also proven to be a protective factor for diseases like cardiac issues, cancer, and also helps to delay the onset of dementia. Men also have a higher risk of cardiovascular disease than women. Most of the risk factors come from being overweight and obese. And then also one of the last ones is that exercise can fight off depression and anxiety by releasing endorphins. Also of note is there are studies to show that doing exercise in a group setting will help decrease loneliness, which will also help with fighting off depression and anxiety. The risk factors for cardio disease in the elderly. This is a study actually done in Tehran, but 48.1% of men of all from obese and overweight is a risk factor to cardiovascular disease. Lack of exercise is 36.4%. Exercise does help keep the heart healthy. The heart is just a big muscle, so keeping that moving is just like working any other muscle. Dietary risk factors for cardiovascular disease includes high triglycerides, high cholesterol, high blood pressure, which are all stem from lack of physical activity. And also of note, most people who get into physical activity take it on as a lifestyle, which includes a healthy diet as well. With the importance of physical activity amongst the older people, it also helps for those who are limited in mobility. You may be wheelchair bound using a walker or a cane, so these exercises that are out there can actually help strengthen some of those muscles to prevent having to use the aids for walking and mobility. The endurance training will decrease resting and submaximal heart rate, taking that stress off the heart, which will also decrease cardiovascular incidence and disease. This is actually an elderly woman running. Based on the picture, it looks like it's the start of an endurance race. It could be 10K, could be half or a full marathon. Also, the exercise improves mental health in older adults. Outside of the weight loss and cardiovascular system, improves mental health by fighting off depression-like symptoms. Release of the endorphins in the frontal cortex is what fights the depression and other mental health symptoms. Exercise in group settings fights off loneliness, which can also be a trigger for those mental issues to start, not having someone to really connect with. So this will also help improve overall feel of depression, anxiety, and the loneliness in general. On top of the weight loss, maintaining a healthy weight, it also helps fight the slowing metabolism. If started early, a lot of these benefits carry over, but also a lot of these benefits does not have to be started early. You can start exercising as you get older. The benefits are still going to be there. So with mobility issues, as we saw with cardiovascular, healthy weight, There's also studies to where exercise can keep your brain young. There was a study based in Sweden of 1,000 women over 40 years. The better off the women were in shape, could push dementia back an average of 9.5 years. It's also showing really good signs of leading to a cure for dementia and Alzheimer's there. However, there are still more tests to be done, so this is not a overall conclusive thing based on the cure part of this study. These elderlies are actually lifting weights, which is actually shown to improve the muscle structure in the legs, in the arms, which will aid in mobility. Also prevent falls, which can be a big issue for elderly people. This one says actually physical activity is medicine. Out of the 3.2 million deaths each year linked to inactivity, the chronic disease that is linked to physical activity going down is going up. Sedentary lifestyle is catching up to the elderly. The 5 main risk factors for death: high blood pressure, smoking, high blood glucose, which is diabetes, physical inactivity, and obesity. 4 of the 5 of those can be can be linked straight to physical activity. So earlier, keeping the healthy lifestyle going will take out the smoking, which will actually reduce all 5 of those risks. And right here it says with the breakdown of physiological systems, it does not help with keeping active. So keeping active keeps the hips and the knees and the legs strong. Also helps with flexibility to be able to not fall, or if you do fall, it turns into a not so much of a life-threatening incident. These are some pictures submitted by my classmates in the forum. This both shows using weights in a classroom or a group setting, fighting off the loneliness. And you can see, while they are just generic pictures, they're all very happy in these pictures. So the depression, the endorphins are being released, so they are fighting off the depression and the anxiety from there. And on top of it all, exercise is just fun to do. Here are the different works I have cited. Top one is the study out of Tehran. These are actually, the Riddle Village one is one of the popular sources, and also the Cervix right there, and were most of the popular sources as well. So we have some really good ones there. And then the honor pledge for that I did not steal any of this, or it was cited just the way that it should have been. Let's see if I can get back to this now. So that is the benefits of the exercise for the elderly. My name is Cameron Lewis for English 112. Thank you.